what particularly have you noticed with low back pain?
Tons of like lumbar radiculopathy, and just sciatic-like presentations because people are just sitting more. They're not getting their activity. And a lot of people, like myself included, if you take the gym away from me, like I'm going to have a really hard time keeping my back feeling good because my back thrives on movement. I need to deadlift at least twice a week, pretty heavy, for my back to feel good. And if I sit for a long period of time, I know I'm going to have to dig out of a hole because my back is going to feel like warmed up garbage. And so in a lot of these people, they rely on these fancy ergonomic chairs and back supports. The only saving grace is you're cutting people's commute out because if they do have a long commute, some of those people do feel better because they're not trapped in a car for 2 hours a day. But if you look at the general workflow, when you are in a large office, you may work for 30 minutes and then you got to go down the hall to a meeting, and then you got to go get something off the printer, and then you got to go to the water cooler and chat it up and stand for a little bit, and then you got to go to the bathroom. Where some of these people, they're able to just hammer down for 5 or 6 hours and maybe get up to pee once, and they're not sitting in a good chair. They don't have the super ritzy work from home setup with adjustable monitors, and they're just staring at this laptop screen. They're probably sitting on their couch, and they're just not getting good variety of movement.
Okay. Any tips for working at home?
So all my patients that are working from home, I measure them on the height that they need for a standing workstation. So I just have them stand up, relax their shoulders, bend their elbows at 90 degrees. And I take my measuring tape that I use for measuring calves and ankles for braces, and I measure 1.5 inches below where their elbows hit their sides. So that gives them a nice downward angle for good ergonomics with their wrists. They're not going to have Tommy Boy shoulders, and they're not going to be like leaning because it's too low. So then they can go home and go, okay, my kitchen counter is 6 inches too high, so I'm going to go and shim this up and stand on this and then put a little mat on there. So then that's my standing workstation. So I tell people like, okay, work for a couple hours in the chair and then work for an hour standing, and just try and gradually ramp up your standing work so you can at least get some movement in there. And depending on the person's orthopedic situation, I'm like, okay, every hour do 15 squats. Or like a couple toe touches just to get some movement in the spine. I'm like, it doesn't have to be fancy. Just do something that you weren't doing that caused your back to hurt.
Right. That almost leads me into, because I've got this question so much, and I feel like I can give this answer to patients, but I almost don't want to, because then they'll be like, all right, well, what's the best home workout? And I'm like, the one you're not doing, or the one you do consistently. But my question to you, I'm sure people have asked you this, like, maybe I don't have any weights. Maybe I've got some 5s at home. What do I do to work out at home, Dr. Askey?
So if I have someone who's deconditioned, and that's another thing that people are just wrecking themselves, like the gyms are closed, so then they go pull their pink Nike Frees out of the closet that are 5 years old and run like a baby elephant, and they wonder why their knees and their feet hurt. If they're deconditioned, I make sure they have some good shoes, and I tell people like walking is the best thing that you can do. Like, go walk. Listen to some podcasts like Your Glorious podcast, or download some audiobooks, learn something. Like Nietzsche produced some of his best work walking because he had intractable migraines and he couldn't sit. So some of his most famous stuff he wrote when he was walking. So in some of the greatest thinkers did their best work when they were walking. And so it has kind of gotten like stigmatized as an old person's exercise or people with a dog's exercise. But I do like seeing people out on the trails more and getting some vitamin D and getting outside and exercising in a low risk environment. I'm like, go walk. And if the person has a little bit higher fitness level and they have some dumbbells or some weights or some kettlebells. I'm like, do some weighted carries. Like, take that weight on your walk with you. If you have a weighted vest, wear that to walk. If you have a backpack, put some weight in the backpack and go for a walk. And then if you're proficient at running and you've kind of passed the test that I know it's safe for you to go run, like we'll give you like a couch to 5K, but not a couch to hospital or couch to my table program, and kind of build up on intervals.
Yeah.
The home workout equipment has been just insanely hard to get a hold of. People are just price gouging. They're hoarding. They're buying new dumbbells and they're selling them for $3 a pound. And I'm like, it's not steak, it's a dumbbell. Like, so I don't encourage people to just go, oh, I've never trained before. And then I tell them to go out and buy stuff that they're probably not going to use.
Right.
But in general, you can do a lot with body weight. My people that travel a lot in non-quarantine times, I gear them more towards like a TRX because that's super portable. They can throw it in their business luggage. They can hang it over the door in the hotel, and they're not dependent on a hotel gym. It doesn't, and I'm very reluctant to give people stuff that takes up a ton of space to where if they don't use it, their spouse is going to be on them for getting it out of the house and selling it. And then they're always going to remember who told them to buy it. And so I do love kettlebells because they take up as much floor space as like a small trash can, and they're super versatile to where anything you could do with a barbell, you can do with a kettlebell, and you don't need a squat rack. You don't need a ton of space. You can do snatches, presses, get ups, carries. There's a lot of things that you can do with a kettlebell, and it's got a very small footprint.
Have you seen anybody say that they've tried any particular like home workout, home exercise, and then ended up in your office? Have you noticed any trends with that?
I did see a lot of trends with people like pulling out their old insanity like programs, because that's extremely high in plyometric. Like I see a lot of like plantar fasciitis, Achilles tendinopathy, a lot of gastroc problems if people are not warming up properly, or if they're just going out of the gate to where they haven't done anything and they're on a mission to lose 9 pounds in a day, and they're gonna do insanity every day, twice a day. But in general, like I've had pretty good luck with people doing like yoga videos at home, and just in general, just a lot of people have signed up for like Beachbody, and I haven't seen a lot of those people in my office. A lot of them are just there because they're doing too little, or they're just trying to run and they're not biomechanically or movement pattern ready to run yet.